Yeah, my name is Heine. I'm a consultant psychiatrist and editor of Global Psychiatry Archives. And today in this YouTube video, I wanted to explain a recent paper published from Pakistan, Germany, and the US, as well as Bangladesh. And it's from Khurshid et al. And it's about burnout and suicidal ideation among gynecology and emergency medical professionals. And it's cross-sectional study. And it's about the relationship between suicidal ideation, which are suicidal ideation attribute scale. Then burnout is assessed by the Maslach burnout inventory, and there are quite a few demographic characteristics which will be related to these data. The story is that burnout has been seen by many doctors, and it's a consistent problem. The research in Pakistan hasn't been done that much, so it's now about the assessment of burnout in a sample of doctors and nurses in Pakistan who are working in ops and gynecology as well as in emergency departments. So there's 300 participants, and I come to the first scale and to the first table, and there are more females and males. Quite a few people working in emergency and gynecology. Most of them nurses, physicians, and admin staff as well, but the majority being nurses. They work in government organizations mostly. They have permanent jobs in the majority, and the working experience is usually quite substantial, and some fewer than 5 years, but quite a few more than 20 years. So quite experienced people among them. They work, some work less than 10 hours, which seems to be the normal, but some people have high levels of work, more than 10 days, in 62 out of 300 cases. Um, Most of them married. So what are the results? So come up to that. So this is the burnout scales and subscales and the suicidal ideation. And what you can see is that quite a few people have moderate to high emotional exhaustion, depersonalization, which is part of the burnout scale, um, is quite common as well. So moderate to high depersonalization in more than 200 people. The feeling of low personal complement seems to be high as well. So quite a bit of burnout in that. And quite a few people who have 40 out of 300 having suicidal ideation. Right. So what is the difference between emergency and gynecology? What you can see is that and burnout seems to be slightly higher in the area, or no, burnout seems to be more or less, yeah, it seems to be higher in the gynecology department, and it's significant. However, suicidal ideation with a p-value of 0.82 doesn't show that much of a difference. Right, so what you can see is that people in working ops and gynecology have a higher burnout than people in emergency. You can speculate whether it's related to the stressful events of a birth, but that's a different cup of tea. You don't know the causes because we don't assess the causes. Right. So then are different domains of burnout, as I mentioned, emotional exhaustion, depolarization, and personal achievement. And it seems that some of them were correlated to suicidal ideation. So there are other sub-analysis which you might go into yourself, which means that nurses usually have have less burnout compared to physicians, and in total, female also have more burnout. So physicians and female physicians are very much prone to burnout. So this is the take-home message. There are other things you might have a look at this. And if you're interested in this such of paper or writing a paper, please get in contact with us at www.globalpsychiatry.co.uk. That's a journal, or you can check what we produce here on this YouTube channel yourself. Thanks for your interest, and I hope you enjoy this recording. Thank you.